We hear a lot about side effects. A lot of parents are concerned about side effects of medications, vitamins, whatever it may be, and deservedly so. What are some of the most common side effects that people can expect with this therapy?
Methyl-B12 will cause hyperactivity in a significant number of the children. And, with hyperactivity, oftentimes we have them stim more. It will do that. And the other thing that they'll do is as the nerves start coming back alive, the first nerves that come back alive are the short ones here, to our mouth. And so they'll start mouthing objects, biting on things. And these children have already been doing a lot of these things. So those are the main side effects. On my website, we talk about, I gave an article. It was from the Autism 1 conference in Chicago in 2005. There I talk about what I call the positive, effects, the negative effects, and what I call positive, negative, and negative, negative, and what's tolerable and intolerable. If you have a tumor and we need to take it out, in order to be successful, you have to have pain for me to have that surgery done, and you're going to recuperate. And that's one of the things. So if methyl-B12 is done long enough, most of these side effects will go away. A child who's 3 or 4 years old, when he becomes more aware, what happens is all of a sudden he'll start biting, pinching, kicking more, because he's speaking to you in perfectly good autismese. He doesn't, he thinks you got the problem because you're not listening. He knows exactly what he's saying and you're not doing it, and he's upset. So parents will sit there sometimes and say he's more belligerent, he doesn't listen, he's biting, kicking, and screaming, or they tell him to put the Game Boy away where he used to do it and be more compliant. Now he isn't. It's because he knows he has rights in this world and he wants to do what he wants to do, and you don't, you're in his way. And so most of the side effects there, the positive, negatives, is when the child is challenged or tried to be redirected, and it's not really a negative. There's no such thing as hot fire and cold fire. Fire is always hot. If I put a match to you, you're going to jump all the time. Not sometimes you'll jump, sometimes you won't. So if a child is actually, you start methyl-B12 and they have a problem and it's an intolerable problem all the time, then that's hot fire, take it away. But it's not that he's perfectly fine, he's coming more alive, he learns more about this, he's doing better, speaking better, acting better, and then all of a sudden you try to redirect him and say, put your Game Boy away, we've got to eat, we got to go to bed, we got to take a bath, and he has a fit. That's because he knows that you're bugging him and you're trying to redirect him. So those are the kind of things. And so if a person knows how to understand the tolerable from the intolerable, and it is in that article, that's really important. And they need to know a positive negative from a negative negative. Those things are extremely important, because if you know that, you can stay the course. And what happens within 4 to 6 months, usually these things will go away. You'll keep the positive and you'll lose the negative, because it takes a certain amount of time for the body to reach a new equilibrium. As you upregulate one set of enzymes and downregulate other sets of enzymes, these are the things that happen. So as long as it's a positive, negative, and tolerable, I have my patients go through, and it's amazing. Within 3, 4, 6 months, the bad goes away or almost diminishes completely. We keep the good, and that's the whole thing. And I think that's something different in my practice, how I approach that.
Well, it's something that I see in my practice all the time. I appreciate you describing it that way.